This segment is sponsored in part by One Brooklyn Health.
Well, March is Colorectal Cancer Awareness Month, and One Brooklyn Health is on a mission to raise awareness in the community.
We are joined today by OBH experts Dr. Derrick Cheung, Chief of the Division of Gastroenterology, and Letisha Dolor, Clinical Director of Gastroenterology. Welcome to New York Living.
Thank you.
Thank you for having us.
Thank you.
Very, very important subject.
Huge.
Yes, that we were talking about. So, Dr. Cheung, let's be honest. A lot of people don't want to talk about cancer at all. Never mind colon cancer in particular. Why is it important that we overcome this?
So colon cancer is one of the few disease processes that we know of where we actually have proven screening tests like colonoscopies and screening tools like stool tests to detect and prevent and sometimes even cure colon cancer. So when I perform colonoscopies for my patients, what I'm doing is I'm looking in the large intestine, in their colon, and I look for these growths in the colon called polyps. And during the procedure, I can actually remove these growths, and this is how we prevent colon cancer, because people don't realize that sometimes these growths are considered precancerous, and if they're left unchecked, they'll grow and become colon cancer in a few years. So one of the hesitancies I see when patients are referred to see me is they don't want to drink the bowel prep. And so a lot of the times they ask me like, oh, do I really have to drink the 4-liter bottle of solution? And my answer to them is no, because there's actually a lot of different products on the market now that are available that require less volume, so you don't have to drink as much, and there's even some preps that are only pill form, so it makes preparing for the colonoscopy much easier. And a lot of people don't realize that colon cancer is actually the second leading cause of cancer-related deaths in men and women in the United States. And even more troubling is that we're seeing more and more patients being diagnosed at a younger age, often below the age of 55.
Wow.
So it's really important to get the word out and raise awareness and educate our patients and healthcare providers, because this is the best way that we can fight this terrible disease and ultimately save more lives.
That's right.
There we go. Letisha, what do we know about colon cancer and racial outcomes? Racial outcomes in both the diagnoses and then the treatment.
Okay. So African Americans bear a disproportionate burden when it comes to colorectal cancer. 20% of African Americans will be diagnosed with colorectal cancer, and 40% of African Americans will eventually pass away from colorectal cancer. The reason being is various disparities within the communities and even just as Americans with obtaining proper health care, and they have different, how should I say?
I'm sure access to healthcare is very different. Sure.
Unfortunately.
To the shock of no one. I
Right.
mean, we talk about this frequently.
Yes, and risk factors.
Sure.
These play, it could be genetics, different risk factors that play a crucial role. And unfortunately, it is African American, our black and brown people that are at a highest risk for developing colorectal cancer.
Sure. Dr. Cheung, why is this called the hidden cancer, colon cancer?
Well, the problem with colon cancer is that oftentimes people don't have symptoms until it's too late. So when I see patients in the hospital, and unfortunately I sometimes have to diagnose them with colon cancer, oftentimes it's too advanced or it's spread to other organs because it's detected too late. So it's very important to advocate that our patients get screened at the appropriate age, which is 45, if you have no risk factors. And sometimes they have to get screened even earlier if they have a family history of colon cancer or polyps or these growths in the colon. So, when I see these patients, I sometimes think to myself, like, could this have been prevented? If they had been screened earlier, or why didn't they get screened at their age appropriate time? Because this whole crisis could have been averted. And so patients, when they see me, I tell them, especially if they're below the age of 45, that they have to look for certain symptoms such as blood in the stool, or if they see blood on the toilet paper even when they wipe, unintentional weight loss or abdominal pain, or I tell them to pay attention to their bowel habits. So if they're seeing that their stool is different, like thinner or different
Then
colors.
they need to
Call him.
let you
They
or
definitely need to see
let
someone,
their
yeah.
physician know.
Letitia, my next question for you, what is the message that you want to get out to folks who might wonder if they are at risk of colon cancer?
The most important message, get screened. Screening, prevention is detection. So what we do at One Brooklyn Health, our mission, we are committed to screening and preventing colon cancer within our community and for all New Yorkers. Anyone age 45 and even younger, if you are having symptoms or have a first-degree relative, such as a mother, a father, a sister,
get
brother,
screened.
go get
Go
screened.
get screened, and you guys are providing the resources. We thank you both so much
Yes.
for joining us today.
Thank
Really
you.
important information.
Thank you so much.
And don't forget, you at home, you can get more information by scanning that QR code on your screen to learn about where to find those screenings for preventative care for colon cancer.